Hypertension is defined as raised blood pressure. It could be primary and secondary. Primary is if there is no cause, and that is what we call essential hypertension. It's the commonest form of hypertension. About 85% of hypertension is essential. It's linked to genetics, and it can be exacerbated or brought on by our lifestyle, and I will come to that later. And then there's secondary hypertension that is due to endocrine problems like Cushing's syndrome or Cushing's disease, the hypertension that is caused by chronic kidney disease like chronic glomerulonephritis and so on and so forth. So as part of the assessment of somebody with hypertension, we do blood tests, urine tests, we do kidney scans and CT scans to find out whether hypertension or high blood pressure may be due to these other conditions. How do we diagnose hypertension? Normal blood pressure is systolic over diastolic. Anybody with systolic blood pressure of less than 120 is normal. Less than 80 is diastolic. That's the ideal. Blood pressure of systolic 120 over diastolic 80. Whereas in a patient with high blood pressure, anybody above with blood pressure above 120 is something to be watchful. It's a range that we need to be watched, that needs to be watched very closely. Anybody that has a blood pressure above 140 over diastolic above 90 is definitely diabetic. Anybody with between 120 and 140 systolic and 80 and 90 diastolic needs to watch it very closely, because they need to be monitored closely. They need to be go into a strict diet, especially salt. Salt intake is one of the key factors that can cause high blood pressure. And unfortunately, in Africa, most of our food has a high salt content. Apart from that, we also add salt. Please don't add salt to food on the table. Once food is already cooked with salt, remember some of the food items we are eating are food that are processed food and that are canned food, and then they are already, salt is already added to preserve them. When we are cooking them, we add salt again, and then on the table, some people add salt again to taste. Food does not have to taste salt. We only need 5 grams of salt in a day, and sometimes that 5 grams of salt can be obtained from one sitting, and you don't want to predispose yourself to high blood pressure by taking too much salt. So please take note of that. I will come back to that later. So how do we treat blood pressure? Hypertension is treated by antihypertensive medication. There are different classes. The main commonest ones are ACE inhibitors or angiotensin receptor blockers, beta blockers, calcium channel blockers, and diuretics. There are also other ones like alpha agonists and also many other groups that I don't want to bore you with the details, but those are the 4 groups that are generally used